You know, that nagging ache, maybe that stiffness that just won't seem to quit. Joint pain. Well, it's something you and honestly so many people experience.
It really is incredibly common.
But what's really striking is how much um, maybe wishful thinking surrounds it.
Mm.
Or just old wives' tales. We've all heard those quick fixes and, assumptions.
We absolutely have, and that's exactly why we're doing this deep dive today. You shared a fantastic piece with us, really evidence-based, looking at common joint pain myths.
Right?
And our mission really is to cut through the noise and get straight to the science.
Yeah, let's do that.
We want to arm you, the listener, with a clear, research-backed understanding, something that goes beyond just, simple advice and really digs into what the data tells us.
Absolutely. Okay, so digging into that material you shared, one myth that really jumped out was this idea, this assumption almost, that joint pain is just, part of getting older.
Inevitable, right?
Yeah, like you hit a certain birthday and boom, your joints just start complaining. It's programmed in.
That is such a widespread belief. But the evidence, it suggests a much more, let's say, nuanced picture.
Okay.
While, yeah, sure, the likelihood of things like osteoarthritis does increase with age, joint pain is definitely not an exclusive club for older adults. Not at all.
Right. And that piece you sent over mentioned a study, I think it was the Journal of Athletic Training.
That's the one.
It found that around 30%, nearly a third of athletes between 18 and 25 reported experiencing joint pain.
Yeah, think about that. Young athletes.
These are people who are supposedly in peak physical condition.
It is significant, and it starts to make more sense when you look at what might be contributing to that pain in younger people.
Like what?
Well, sports injuries, obviously, especially high-impact activities. That's a big one.
Makes sense.
Then there's repetitive motion strain. That can come from work, sure, but also hobbies.
Oh, yeah, definitely. Think about someone at a keyboard all day.
Exactly. Or a musician, maybe, practicing the same movements over and over.
Hours and hours.
You can easily see how that could lead to discomfort, whatever your age is. And we shouldn't forget autoimmune conditions like rheumatoid arthritis. That can certainly show up in early adulthood.
Right. That's not just an older person's condition.
No. Plus, the impact of excess weight on our joints, the ones carrying the load, that affects people of all ages too.
And there was another study in the material, wasn't there? Occupational medicine. That one was really interesting.
Yeah, that one really highlights the activity factor.
It showed nearly triple the joint pain in workers under 40 in physically demanding jobs compared to, desk jobs.
Triple. It just drives home the point, doesn't it? It's not just about the number of candles on your cake.
Not at all. It's kind of an aha moment. Age is a factor, sure, but not the only determinant.
Precisely. It really makes you think, doesn't it? Have you considered, how your own daily grind or maybe past injuries might play into any joint stuff you feel, regardless of your age?
It definitely gives you food for thought. Okay, so myth busted. It's not just for the elderly. But then there's this other feeling, this sense of resignation, maybe. If you do have joint pain, well, that's it. You're just stuck with it.
Oh, that one's common too.
Like, guess this is my life now.
Yeah, that fatalistic view. And it's disheartening, frankly. But the science, the actual evidence really argues against just, giving up.
It does.
Absolutely. There's a ton of research showing that different interventions can genuinely lead to significant pain reduction and, importantly, improve how well your joints actually work.
And the numbers you shared were actually pretty encouraging. That British Medical Journal meta-analysis, that's where they combine lots of studies, right?
Exactly. It gives you a much bigger picture.
And it reported an average pain reduction of 40 to 60% with the right approaches.
40 to 60%. That's not insignificant. That's life-changing for some people.
It really shows it's not something you just have to passively accept.
Not at all. And it's crucial to talk about the variety of things that work, things backed by evidence. Well, physical therapy, for one. Targeted exercise programs designed to strengthen the muscles around the joint.
Ah, the support structure.
Exactly. And improve how the joint itself moves, its range of motion.
And you mentioned diet earlier, too. We'll get more into that. But anti-inflammatory eating. That can help.
It definitely can. Also, weight management, if extra weight is a factor, that reduces stress on those load-bearing joints like knees and hips.
Makes sense. Less load, less strain.
Right. And just thinking about proper body mechanics, ergonomics, how you sit, how you lift, that matters.
Little things add up.
They do. And of course, there are appropriate medical treatments when needed. But the main point is you can be proactive. You're not just destined to endure it.
Okay, that leads us right into another biggie. The fear of exercise.
Ah, yes.
So many people think my joints hurt. The absolute worst thing I can do is move them.
Yeah.
Stay still. Protect them.
It's such an understandable fear, isn't it? Pain tells us to stop. But the scientific reality, it's often the complete opposite.
Right.
Yes. Appropriate exercise is frequently one of the most effective ways to manage joint pain. It seems so counterintuitive, I know.
But the research backs it up.
Oh, absolutely. That New England Journal of Medicine study on knee osteoarthritis, really striking.
What did it find?
A 47% reduction in pain for patients who did moderate exercise compared to the ones who didn't.
Almost half. That should be incredibly encouraging for anyone with knee pain.
It really should. That 47% isn't just a number. It shows how movement can actually, help calm down those pain signals. It challenges that instinct to just freeze up.
So what kind of exercise are we talking about? Not like running a marathon on a bad knee, presumably.
Definitely not. No, we're talking low-impact stuff. Things like swimming, cycling, using an elliptical machine.
Easier on the joints.
Right. You get the movement without the pounding.
And strength training is key too, you said.
Crucial.
Yeah.
Building up those muscles around the joint provides better support, better stability.
Like a natural brace.
Kind of, yeah. They act as shock absorbers, help protect the joint. And range of motion exercises, too, just keeping things moving, preventing stiffness.
Flexibility.
Exactly. And don't forget things like yoga or Tai Chi, mind-body practices. They combine gentle movement with stress reduction, a whole-person approach.
It's pretty amazing that one review, I think it was Arthritis Care and Research, it concluded that exercise therapy should be like a first-line treatment. Sometimes even as good as or better than.
Yeah, that's right. Often equaling or exceeding pharmaceutical benefits in many cases. It totally flips the script on that old just rest it advice.
Right.
It really underscores how important it is to work with, a doctor or a physical therapist to figure out an exercise plan that's right for your specific situation.
Okay, let's shift gears a bit. Let's talk about food.
Yes.
Diet.
Good topic.
Because for a long time, it really felt like diet was just dismissed when it came to joint pain. It was all about meds or PT.
That's true. The nutrition link hasn't always gotten the attention it deserves. But there's a growing body of evidence now, really solid science, making it clear that what we eat can have a pretty big impact on inflammation levels and consequently how our joints feel and function.
And you mentioned a 2023 study, Journal of Clinical Rheumatology.
Yes.
It showed a 25% greater pain reduction in people following an anti-inflammatory diet.
That's pretty compelling.
It is compelling, and it points towards specific things in our diet that can help.
Like what kind of things?
Well, omega-3 fatty acids are a big one. You find those in fatty fish like salmon, also flaxseed, walnuts. They're well-known anti-inflammatories.
Oil supplements too, I guess.
That's often where people get them, yes.
Yeah.
Then you've got antioxidant-rich fruits and vegetables. The bright colors, berries, leafy greens, they help fight oxidative stress.
Eat the rainbow, basically.
Pretty much. And don't underestimate spices. Things like turmeric, ginger. They have powerful anti-inflammatory compounds used for centuries.
Right, curcumin and turmeric. Exactly. And just staying hydrated, drinking enough water, that's important too. It helps maintain the synovial fluid that lubricates your joints.
Didn't think about hydration like that.
It matters. And on the flip side, research suggests some foods might actually worsen inflammation.
Oh, no? Like what?
Things like refined sugars, processed meats, maybe excessive alcohol. So paying attention to your plate can be a really proactive step you can take.
Makes sense. Fueling your body right or not.
Precisely.
Okay, now, this next area,
Uh-huh.
supplements. It can feel like navigating a minefield.
That's a good word for it.
There are so many bottles on the shelves.
Yeah.
So many promises. How do you know what actually works and what's just snake oil?
You're right. There is a lot of skepticism. And honestly, often for good reason. There's definitely junk out there. But to just dismiss all joint supplements would mean ignoring some pretty decent scientific evidence for specific compounds. It's not all or nothing.
Okay, let's break that down then. What does have some science behind it? Glucosamine and chondroitin, those are everywhere.
They are the most common, probably. And that big meta-analysis, the one in the International Journal of Rheumatology,
Yeah.
it pooled data from over 50 trials, thousands of people. It found that the combination did provide moderate pain relief, comparable to some NSAIDs like ibuprofen, especially for people with moderate to severe osteoarthritis.
Moderate relief. Okay, so not a magic bullet, but potentially helpful for some.
Exactly. Then there's collagen peptides. Hearing more about those lately?
I have, yeah. What's the deal there?
Well, research suggests that certain types, specific, easily absorbed ones, can improve joint comfort and function. One study, 24 weeks long, found a pretty significant 38% reduction in discomfort with 10 grams a day.
38% is noticeable. And the specific dose matters, you're saying?
Dose and type seem to be key for collagen, yes.
Okay. What about MSM? That's another one I see.
Right, methylsulfonylmethane, MSM. There's a systematic review suggesting it can lead to, meaningful improvements in pain and function.
How much do people usually take?
The studies generally looked at doses between 1.5 and 6 grams daily. And importantly, it often takes a bit of time to see effects, maybe 4 to 8 weeks of consistent use.
Good to know. Managing expectations there.
Definitely.
And more natural things. Turmeric, boswellia.
Yes. Curcumin, the active part of turmeric, has shown real promise. A 2019 meta-analysis found it significantly reduced pain and inflammation markers, especially formulations designed to be absorbed better by the body bioavailability matters there.
Right, because plain turmeric isn't absorbed that well.
Not on its own, no. And Boswellia serrata, that's Indian frankincense, also has research showing it can reduce pain by inhibiting certain inflammatory pathways.
So it sounds like there is real science for some of these, but the catch is quality.
Absolutely crucial. You want products that are third-party tested for purity and potency. Look for reputable manufacturers. Otherwise, you might not be getting what you pay for, or worse, getting contaminants.
Buyer beware, definitely. Okay, this next myth. I think this is a really deep-seated assumption for many people. If your joint hurts, there must be damage inside. Like pain equals physical damage, 1-to-1.
It seems logical, doesn't it? Pain is a warning signal, so it must be warning about structural damage. But the whole field of pain science has shown us it's more complicated than that.
How so?
What's really fascinating is that the link between what imaging tests show, like X-rays or MRIs, and a person's actual experience of pain isn't always straightforward.
You mean you can see damage, but the person feels fine? Or vice versa.
Exactly. Remember that New England Journal of Medicine study you mentioned earlier? It found structural issues, things like cartilage defects or tears, in something like 61% of people who had no pain at all.
61% with no pain despite having damage. That's wild.
It really challenges the assumption, doesn't it? It tells us that pain is more than just a reflection of tissue state.
So what else is going on?
Well, there are conditions like fibromyalgia where people experience widespread pain without any visible joint damage. And then there's this concept called central sensitization.
Okay, what's that?
Think of it like your body's pain alarm system becoming overly sensitive. It starts firing off danger signals even when there isn't a new injury or threat in the tissues. The nervous system itself becomes amplified.
So the pain is real, but it's not directly caused by current damage in the joint.
The pain is absolutely real, yes. But its intensity might be amplified by the nervous system. And other things can turn up the volume too, psychological factors like stress, anxiety, depression.
The mind-body connection.
Definitely. Poor sleep is another big one. Even your past experiences with pain can shape how you feel pain now.
So treating joint pain effectively might mean looking beyond just the joint itself.
Precisely. Often the best approach needs to address both the physical aspects and these other contributing factors. The nervous system, sensitivity, psychological well-being, sleep, stress. It's a holistic picture.
Fascinating. Okay, last myth for today. Rest.
The go-to solution for many.
Right. Something hurts, just stop using it. Rest it completely. Is that always the best advice for joint pain?
Well, short periods of rest can be helpful, especially right after an acute injury or during a bad flare-up. Give things a chance to calm down. But prolonged rest, like weeks of immobilization, that can actually be counterproductive for many chronic joint conditions. It sets off this sort of negative chain reaction.
Okay, like what happens if you rest too much? Muscles get weak.
Exactly. Muscle atrophy happens pretty quickly. The muscles supporting the joint get weaker, which means less stability.
Makes sense.
You also get less production of synovial fluid, that joint lubricant we talked about. Cartilage doesn't get nourished as well because that depends on movement. Bone density can decrease. Even the connective tissues around the joint can shorten and tighten up.
Wow, so resting it too much can actually make things worse in the long run.
In many cases, yes. And that physical therapy review, it strongly suggested that getting back to early, appropriate movement leads to better outcomes than just extended rest for a lot of joint issues.
So what's the approach then, if not complete rest?
The modern thinking is around something called optimal loading.
Optimal loading. Okay, sounds technical. What does it mean?
Basically, it means finding the sweet spot. Finding the right amount and the right type of movement for that specific joint and condition. Not too much activity so you don't aggravate it, but enough activity to encourage healing, maintain strength, and keep the joint healthy.
So it's not no pain, no gain, but it's also not no movement until zero pain.
Exactly. It's about finding that therapeutic balance, moving in a way that supports healing and function rather than just complete shutdown.
That makes a lot of sense. It's more active, more nuanced.
It is.
This has been incredibly clarifying. So wrapping things up, the big takeaway for you, our listener, seems to be that really managing joint pain effectively means looking past these common myths. It requires an evidence-based approach.
Absolutely. It involves considering appropriate physical activity, that optimal loading idea, making smart choices about diet, managing weight if needed,
Right.
maybe exploring specific quality supplements if they seem appropriate for you after talking with a professional, getting guidance from doctors or physical therapists.
And managing stress, getting good sleep, paying attention to ergonomics.
All of it contributes. It's a multifaceted approach.
It really feels like, based on the science, joint pain doesn't have to be this downhill slide you just accept.
No, at all.
There are real, proactive, informed steps you can take that can make a genuine difference in how you feel.
That's the empowering message here.
So, maybe a final thought for everyone listening.
Yeah.
Take a moment and reflect on your own beliefs about joint pain. Have any of the things we discussed today, the science we talked about, challenged what you thought?
Good question to ponder.
Maybe dig a little deeper into some of these concepts yourself. What is optimal loading for your situation? What role might central sensitization be playing, if any? Because understanding the science, as we've seen, can fundamentally shift how you approach your own joint health. It doesn't have to be a life sentence. Proactive steps really can help.